Next, you're going to see about the arteries of upper limb, and first is subclavian artery, and this is arch of aorta and brachiocephalic trunk, and it gives into two branches, and that is right subclavian and the right common carotid artery, and this is left common carotid artery, and then left subclavian artery. And now we can divide the subclavian artery into three parts. And the vertebral artery is also arises from the subclavian artery. From the first part, we have internal thoracic artery, and second part and third part costocervical trunk, and the second part is thyrocervical trunk, and it supplies arteries to parathyroid and inferior thyroid and the suprascapular. Then we come to internal thoracic artery. It gives branches to, usually this is descending aorta. Descending aorta gives posterior intercostal arteries up to 12 posterior intercostal arteries. And then internal thoracic aorta gives rise to internal intercostal arteries. First, second, third, fourth, fifth, and sixth. From the sixth intercostal artery is divided into two parts. This is superior epigastric artery, and the second part is musculopharyngeal artery. From the musculopharyngeal artery, other three branches of intercostal arteries are arises. And then we come to third part, costocervical trunk. Costocervical trunk gives to first two branches, it anastomoses with the first two branches of intercostal arteries, and this is superior intercostal arteries.
Then axillary artery divided into the three parts. First part superior thoracic artery, second part lateral thoracic artery, third part subcapillary artery, and anterior posterior circumflex artery. Then brachial artery divided into the four parts: anteriorly, posteriorly, medially, and laterally. Then anteriorly, upper part crossed by the medial cutaneous nerve of the forearm. Then medial part, median nerve, lower part bicipital aponeurosis. Then posteriorly upper part, the medial head of the triceps, long head of the triceps, and coracobranchials and branchials of the muscles. Then medially upper part is the ulnar nerve, and the lower part is the median nerve. Then laterally upper part median nerve, triceps, branches, and coracobranchialis. Then branches. Branches, there are four branches. First, inferior ulnar collateral artery, then superior collateral artery, then perpendicular branchial artery, then nutrient artery.
After the continuation of the brachial artery crosses the content of the cubital fossa, then gives rise to radial artery and ulnar artery. Radial artery forms pulmonar arch, deep pulmonar arch, and the ulnar artery forms superficial pulmonar arch. Then radial artery branches are triceps pollis artery and radialis indus artery. But ulnar artery gives supplies blood to 3.5 of the skin and the finger. Triceps pollis artery gives supply to the lateral and medial part of the thumb, and radius indus artery gives blood supply to the first one. Radial artery branches triceps pollis artery and radius index artery. Triceps pollis artery gives supply to the thumb in lateral and medial view, and radius indus artery gives blood supply to the lateral part of the index finger. And here forms ulnar artery forms superficial pulmonar arch. The branch here is deep pulmonar branch artery, and the branch formed by radial artery here is deep pulmonar arch branch. here the branch formed, which is a part of radial artery, this superficial pulmonar branch artery. Then it supplies. Then the test here is given for ulnar artery is Allen test.
Now we are going to explain about the veins of the upper limb. There are three types of veins. That is the superficial vein, deep veins, and the perforating veins. Superficial veins are located in the subcutaneous tissue. Deep veins are located underneath the deep fascia. The perforating veins, it is a connection between the deep and the superficial veins. Then the deep veins are paired veins. The examples are the radial vein, ulnar vein, and the brachial veins. The superficial veins, basilic vein, cephalic vein, and antebrachial veins. Now we are going to see how the superficial veins formed. This is the dorsal digital veins. These are the dorsal digital veins. The dorsal digital veins joins to form the dorsal metacarpal veins. The dorsal digital veins are the paired veins. They join to form the dorsal metacarpal veins. There are some other veins. There are some other veins which are not forming the dorsal venous arch. Only these veins are these three veins forming the dorsal venous arch. But there are these four veins are not included in the dorsal venous arch. Then how the cephalic and the basilic vein is formed. The two dorsal digital vein from the thumb and one dorsal digital vein on the medial side of the index finger, and then the medial side of the dorsal venous arch. All these join to form the basilic vein, which is on the medial side. In the lateral side, the lateral side of the dorsal venous arch and the one dorsal digital vein on the lateral side join to form the cephalic vein. This is how the superficial veins are formed. Then the deep veins. The palmar metacarpal vein drains into the deep venous palmar arch, which in turn drains into the radial vein. Here the palmar digital vein drains into the superficial venous palmar arch, which in turn drains into the ulnar veins.
The cephalic and the basilic vein around itself and form anteriorly. Cephalic and basilic vein goes into the cubital fossa. The radial vein and ulnar vein come posteriorly posteriorly into the cubital fossa. Between the cephalic and basilic vein, it is the median cubital venous races. In the cephalic vein, the median cubital venous races. The superficial palmar flexus in palmar, this is the medial antebrachial vein. The brachial vein, radial and ulnar vein, and brachial vein, and it attached to the cephalic vein, connection to the axillary vein. Basilic vein also connected to the axillary vein.
From axillary vein, the deoxygenated blood is drained to the right subclavian vein, and in right subclavian vein we have two branches, that is right external jugular vein and right internal jugular vein. And from right subclavian vein we have brachiocephalic vein, that is from the right side, and then we have right vertebral vein, and in the downside, that is in the thorax region, we have right internal thoracic vein. And from the left we have axillary vein, same like that itself, and from the left axillary vein we have two branches, that is left external jugular vein and left internal jugular vein. And from that we get left subclavian vein, and from left subclavian vein we have one more branch, that is left vertebral vein, and it comes down to the left brachiocephalic vein. And from the brachiocephalic vein we have two subdivisions, like subdivisions vein, that is thymic vein, which drains deoxygenated blood from the thymus, and the pericardial vein, same as like that. And this is the one branch which comes from the left subclavian vein, that is internal thoracic vein.
The upper part of the lymph nodes, it is the lymph nodes are vein-like structures. The nodes is visible and vessels is not visible. The upper limb is the main lymph nodes for axillary lymph nodes. It is a 5 groups: anterior groups, posterior groups, lateral groups, central groups, and then apical groups. Apical groups in another name is infraclavicular. Anterior groups, it is they receive from the limb for anterior wall of the upper half of the breast, and then posterior group they receive from the posterior wall of the breast, and lateral group this is the lateral group receive from the upper limb. Central group this receive from floor of the axilla. Apical group they receive from the limbs for infraclavicular and then breast, and then few lymph nodes for infraclavicular nodes and delta pectoral nodes, superficial and cubital nodes, and infraclavicular nodes is received from clavicular. Delta pectoral nodes it is received from lymph from the delta pectoral region. Superficial cubital lymph nodes they receive from the cubital. It is the another side of the arm and the forearm, and the deep lymph nodes, and it's along the medial side of the brachial artery, and then second is bifurcation of the brachial artery.
3.
Lymphatic drainage of upper limb, it is divided into superficial and deep. Superficial vein carries superficial lymphatic drainage, and deep lymphatic drainage carries 5 deep arteries. And 2 veins are important. What are they mean? Cephalic vein and basilic vein. Superficial veins start from palm and dorsum of the hand. It is known as superficial lymphatic plexus, and it drains into cephalic vein and basilic vein. Drainage from the thumb and index finger, it drains into the cephalic vein and goes to the infraclavicular group of lymph nodes. It is under the clavicle bone, and it drains into the apical lymph node, and it pierces through the clavipectoral fascia, and it and the middle finger and ring finger and little finger of the lymphatic drainage, it drains into the basilic vein, and it drains into the deep fascia and goes into the lateral group lymph node of axillary node, and it goes through the deep fascia and supratracheal lymph node. It is in the part of medial epicondyl of humerus, and it goes and drains into the lateral part of group of lymph node. It is a part of axillary lymph node. And these are the superficial vein drainage of the superficial vein, and deep artery, deep lymphatic drainages. The 3 importance are there. What are they means? It is crossed through the 3 arteries: radial artery, ulnar artery, and brachial arteries, and it is a communication with the superficial lymphatic drainage. And it important point is it all comes and drains into the lateral group of lymph node of axillary lymph node. Thank you.
Brachial plexus formation: roots, trunks, divides, cords, and branches. Roots: brachial plexus C5, C6, C7, C8, T1. C5 derives from subscapular nerve. C5, C6, C7 are long thoracic nerve, is known as nerve of Bell. C5, C6 are upper tongue, derives to anterior and posterior, middle, anterior and posterior. C8 and T1 lower tongue, posterior and anterior. Anterior and anterior or lateral cord, posterior and posterior is in posterior cord. Anterior last one is medial cord. Lateral cord branches, lateral pectoral nerve, muscular cutaneous nerve, lateral root of median nerve. Posterior cord branches, upper subscapular nerve, thoracodorsal nerve, lower subscapularis nerve, axillary nerve. Medial cord branches, medial pectoral nerve, medial cutaneous nerve.
Next we have the axillary nerve. The root branch for the axillary nerve is C5 to C6. It have the 2 branches, that is the anterior and posterior. First it will enter into the solar regions, and it gives 2 branches, that is this is the posterior branches, this is the anterior branches. From posterior it will drain into the innervates into the deltoid muscles. From the anterior branch also it will innervate into the deltoid muscles. From the posterior branch it will enter into the pseudoganglion, and it will innervate into the teres minor. Teres minor and the deltoid muscles nerve, which is the motor functions, and the upper lateral cutaneous nerves of the arm, and skin over the lower half of the deltoid. These are the sensory functions. It is the axillary nerve.
Muscular cutaneous nerve is the chief nerve of front arm. Origin is the lateral cord of brachial plexus in lower part of axilla. At lower border of pectoralis minor is the root of ventral lamina C5, C6, and C7. Muscular cutaneous nerve 3 branches: coracobrachialis and brachialis and biceps brachii. Brachialis is attached to ulnar tuberosity. Biceps brachii is attached to radial tuberosity. Is the root of C5, C6, and C7. This is the muscular cutaneous nerve. Mnemonic being that is biceps brachii, brachialis, coracoradialis. This is coraca radialis. Axilla and arm divides biceps brachii and brachialis. Is the tendon of bicep brachii. Last one is deep fascia, lateral cutaneous nerve forearm.
3. The median nerve, which has the root value from C5 to T1, and then in axilla it has no branch. In arm it has a branch which is coming medially to the lateral branch, that is a brachial artery, and then in forearm it has anterior interosseous nerve. It gives off the flexor carpalis radialis and palmar longus and palmar teres muscle, and it is superiorly innervated. And then anterior interosseous nerve, it also gives us the flexor pollicis longus and flexor digitorum pollis and pronator quadratus. Flexor digitorum superficialis, it is intermediate layer, and then it has 2 branches, recurrent and palmar branches. The palmar cutaneous branch, which is innervated laterally to the skin, 2/3 of the palmar region, and then it also innervates to 1 and 2nd lumbricals muscles. The main is thenas muscle, which gives abductor pollis, brevis, flexor pollicis, and ogneus pollicis. And the palmar digital branch medial supplies to the skin laterally, which is by the 3/3 of the digits. That's all. Ulnar nerve, the root value of ulnar nerve is C8 to T1. In axilla it has no branch, but in arm it gives up to the elbow joint, and then in forearm it gives flexor carpalis ulnaris, and then flexor digitorum profundus, and then it has 3 branches, dorsal cutaneous branch and palmar cutaneous branch and muscular cutaneous branch. And in these 3, in palmar we can see palmaris brevis, and it supplies to the skin medial 1/3 of the dorsum of the hand, and dorsum medially to the 1/2 the digits. And then in the muscular region, abductor pollis, and another one is it gives innervates to 3/3 and 4th lumbrical muscles, and palmar digital branch to the skin medial 1/2 the digits.
We have to see the radial nerve. The radial nerve root value is C5 to T1. It has the 2 branches, that is a deep branch and the superficial branch. In radial nerve, we have the 2 functions, that is a motor function and sensory functions. First, it will enter into the axilla. In axilla, we have the posterior cutaneous nose of long. It is the motor function. Then it innervates in the triceps, that is a long head of triceps, and the medial head of triceps and lateral head of triceps, and the anterior muscles. Then it will give 1 branch, that is a deep branch. It will enter into the arm and the forearm. And in the arm, it will innervates in the brachialis and brachioradialis, extensor carpi radius longus, and the elbow joints. In the forearm, we have the superficial branch and also the deep branch. In a deep branch, it will use extensor carpi radialis brevis muscles and supinator muscles, extensor digitorum, extensor digiti mini, and the extensor carpi ulnaris. And it also innervates in the abductor pollis longus and the extensor pollicus longus and the extensor pollicus brevis. And it will also innervate in the extensor indicus. In a hand, the superficial branch terminates in the skin over the lateral point of the 1/3 of the digiti middle pharynx. This superficial branch, deep branch, and lower lateral cutaneous nose of thumb, and the posterior cutaneous nose of thumb. These are all the motor function. Remaining all are the sensory function. That's all.
Now we are going to see about the clinical anatomy of the upper limb. First of all, if we take the first bone, that is clavicle, which is present in this direction. If the clavicle bone has got fractured, this is the main part in which it will get fractured, because this is the weakest part of the clavicle bone. This will make the trapezius muscle to move backwards, to pull the bone backwards, so that the arms can be used for lifting and downing. But this cannot be done by every time, as the trapezius muscle only cannot be used for this hand movements. So it is a first clinical point. And the next one is that it is otherwise called as cleidocranial diastosis. Cleidocranial diastosis, in which the fractured bone will be moving in the medially forward direction, in this direction, so that this will be moving this way, so the arms cannot be lifted up. This is the first point. And the next one is the scapula bone, which is present in this direction, in which the serratus anterior muscle, which gets paralyzed. If the serratus anterior gets paralyzed, so the arms cannot be lifted up. That means it cannot be abducted to 90 degree. That means it cannot be lifted to this direction. After this, it cannot be lifted in upper direction. So this cannot be abducted before above 90 degree. And then third one is the humerus bone, in which humerus means the lower part of the humerus bone, which is joint that is known as elbow joint, which gets normally it is the weakest point in which it gets backside, or it will get dislocated from its original position to the backside position, and this will cause the median nerve to get injury. So median nerve which passes in this direction and which supplies for the hand, this median nerve it will getting injury. And the fourth one is the radial radius. For radius, there is a particular fracture which is known as Benefactor. Benefactor means B-E-N-N-E-T-T. Benefactor means in the radius, the lower border above this wrist joint, there will be a fracture occurring 2 centimeter above the lower part. So this is also known as Benefactor. And then if you lift a baby in this direction, if I keep a baby and lifting with the keeping this direction by lifting the hands, they will be getting a fracture. So the baby will be getting a fracture in the, this is also known as pulled fracture. And then for next one is the ulnar bone. Ulnar bone is nothing but for ulnar bone, it gets mainly in the dislocated in this direction. That means if a person is outstretched or falling in a direction, it will be getting fractured in this direction in this bone, so that it will be pulled off from this joint, from this elbow joint. And another one clinical point is that this ulnar nerve is fixed to the humerus bone in the elbow joint firmly and strongly, so that for the radius bone they can do one supinate and pronate. So if the ulnar bone is not stable in this direction, the radius bone cannot do the supination and pronation. So this is also known as stabilizing bone. And the next one is the carpal bones. In carpal bones, it will get mainly they fracture in the scaphoid bone, and then so the scaphoid bone, which when the scaphoid bone is get fractured, it will cause swelling in the thumb finger and the index finger. And then next is the metacarpals. In the metacarpals, it will be getting fractured in the first metacarpal, which is present in this index finger. So this will be causing crampling of hand, that they cannot be moving this finger and the index finger, because it will be fixed point. So they cannot be displaced from that position. And then last one is the phalanges. Phalanges means in which it is also known as butting spin. Butting spin means if they, for example, if this middle finger gets damaged, so the middle finger will be bandaged with the other normal fingers, so that it will be fixed together. So this is known as the clinical points of the upper limb. So thank you.